Welcome back, everyone, to another explainer. So today we are tackling a topic that gets searched a ton, but is also wrapped up in a whole lot of heavy marketing: Peyronie's disease and the use of shockwave therapy. If you, or maybe someone you know, has been navigating this diagnosis, you've probably encountered just a tidal wave of conflicting information online. Well, our goal today is to cut right through that marketing noise, set a reassuring, strictly clinical tone, and look directly at what the scientific evidence actually says. We're going to separate the commercial claims from the true medical reality of how penis curvature is treated today. Okay, let's dive into this. We'll start with the shockwave question, look at blood flow versus scar tissue, and cover the real benefits of shockwaves. Then we'll walk through non-surgical treatments, discuss when surgery is actually needed, and wrap it all up with prevention and next steps. Section 1. The shockwave therapy question. Does it straighten? All right, let's just address the elephant in the room right off the bat. For a lot of guys diagnosed with Peyronie's disease, this one exact question becomes the absolute focus of every doctor's visit and honestly every late-night internet search. Can shockwave therapy straighten a curved penis? You see, because clinics heavily advertise this therapy, it is totally understandable that patients assume it can just magically dissolve scar tissue and restore a perfectly straight erection. But as we're going to see by looking at the source material, the medical reality of what this technology actually does is way more complex than what you might read on a billboard. Section 2. Blood flow versus scar tissue and the biological differences. So, let's break down how this works. Low-intensity extracorporeal shockwave therapy, or LI-ESW for short, uses low-energy acoustic waves. Now, unlike the high-energy waves they use to shatter kidney stones, these low-intensity pulses don't destroy tissue. Instead, they provide this controlled, gentle mechanical stimulation that basically triggers the body to release signaling molecules. These molecules promote angiogenesis, which is really just a fancy medical term for growing brand new blood vessels, and they improve microvascular circulation. Because it improves blood vessel health, it is a fantastic, widely accepted treatment for mild to moderate vascular erectile dysfunction. And this brilliantly illustrates the core biological disconnect we're dealing with here. Vascular erectile dysfunction is fundamentally an issue of inadequate blood flow. Peyronie's disease, on the other hand, is caused by mature fibrotic scar tissue. We are talking about densely packed collagen fibers that have formed a literal, permanent mechanical barrier inside the penis, which prevents it from expanding normally on one side. Improving blood flow doesn't just automatically dissolve a mature collagen plaque. The biological processes your body uses to build new blood vessels are entirely different from the processes needed to break down dense, stubborn scar tissue. The crucial point here is captured perfectly by leading medical authorities. Investigators have spent years looking into this, and the randomized clinical trials have been remarkably consistent. According to the American Urological Association, and this is echoed by the European Association of Urology too, current evidence simply does not support the routine use of shockwave therapy for correcting penile curvature or reducing plaque size in Peyronie's disease. When researchers actually sit down and measure the curvature angle after this treatment, improvements are generally minimal or completely absent altogether. Section 3. The real benefits of shockwaves and proven clinical outcomes. Now, don't write it off completely. While it won't fix the curve, shockwave therapy definitely has proven legitimate medical benefits for Peyronie's patients. First off, during that early, active inflammatory phase of the disease, it can significantly reduce penile pain by bringing down local inflammation. Second, a large portion of men with Peyronie's also deal with vascular erectile dysfunction. By boosting that local blood flow, shockwave therapy improves erection quality and rigidity. Firmer erections can often make intercourse significantly easier and more successful, which directly enhances overall sexual confidence, even if the curvature itself hasn't changed 1 single degree. Section 4. Non-surgical curvature treatments. Conservative options. Let's look at the actual evidence-based medical care pathway for correcting curvature. We build this progressively, starting with the most conservative approaches. Step 1 is simple observation. If the curvature is mild, stable, and intercourse is comfortable, active treatment might not even be necessary. Step 2 introduces penile traction therapy. This involves wearing a device that applies a gentle, longitudinal mechanical stretch for several hours a day over many months. Connective tissues respond to prolonged tension by remodeling, which can modestly improve the curve and preserve length. But honestly, strict daily compliance is incredibly tough for most patients. Then we move to step 3, which involves direct intralesional injections. And the absolute superstar of step 3 is an injectable enzyme called CCH. Rather than just hoping the scar dissolves on its own, This enzyme is injected directly into the plaque to selectively attack and weaken those dense collagen fibers. Once they're weakened, the physician and the patient perform specific modeling exercises to gradually reduce the curvature. It's highly effective for stable disease with a moderate deformity, but it absolutely requires specialized training to administer, and it does carry risks like temporary bruising, swelling, and in very rare cases, penile fracture. Section 5. When surgery is necessary for severe deformities. Surgery remains the most effective treatment for severe cases that prevent satisfactory intercourse. And there are three main approaches. The first is tunicle plication. The surgeon basically places permanent sutures on the normal, longer side of the penis to shorten it, matching the scarred side and straightening the erection. It has incredibly high success rates, but does involve slight penile shortening. The second is plaque incision and grafting. Here, the surgeon releases the contracted scar and patches the defect with a graft. This preserves length, but carries a higher risk of postoperative erectile dysfunction. The third approach is a penile prosthesis, which is typically for patients dealing with both severe curvature and advanced erectile dysfunction. It mechanically restores rigidity while allowing the surgeon to fix the curvature all at the same time. The big takeaway here is that treatment is never, ever a one-size-fits-all situation. Not every patient needs aggressive treatment. A good urologist is going to engage in shared decision-making, carefully tailoring the intervention to your specific disease stage, your baseline erectile function, your age, and your unique relationship goals. Some men adapt perfectly well to a significant curve, while others experience a ton of distress from a really mild one. It's completely individual. Section 6. Prevention and next steps. Protecting your health. While there's no guaranteed way to prevent Peyronie's disease, since the exact cause still isn't fully understood, maintaining your overall vascular health is absolutely your best defense. Controlling diabetes and hypertension, keeping your cholesterol in check, avoiding tobacco, and exercising regularly all strongly support normal tissue healing and erectile function. Furthermore, practicing safe sexual positions, specifically avoiding situations where an erect penis might be forcibly bent, can really help minimize the mechanical trauma that often sets off plaque formation in the first place. Ultimately, our core message today is this: Peyronie's disease is highly treatable. While shockwave therapy isn't the magic cure for curvature that marketing sometimes claims it is, modern medicine offers a really robust range of options, from traction and specialized injections all the way to advanced surgical techniques. The key is to seek early professional assessment if you notice new curvature, pain, hard plaques, or changes in erectile function. That way you can establish realistic expectations and build a totally personalized treatment plan. I want to leave you with a final question to reflect on. We've seen how deeply vascular health is tied to tissue healing and overall sexual function, right? Knowing that the absolute best medicine is often just being proactive, what step will you take today to optimize your vascular health and protect your overall well-being? Take control of your health based on scientific evidence,